Hi, Donna. How are you?
I'm good, Tatiana. Thank you so much for having me.
Thank you for coming and speaking with New Beauty about your particular case. So, you had a facial injury that caused a scar, and you went the non-surgical route with Dr. Mary Lupo. Can you share a little bit about the injury that left you with a scar?
Sure. We were building a home, and there was a second floor with an area that that I thought I needed to measure. There was a ladder on site, an extension ladder. So I climbed it. Didn't even think not to climb it. And went up. I was about 10 feet high and fell to the ground, which was basically concrete. Um, I fell with the ladder, so I was holding on to it, yeah, and I mean, I had some lung injuries, but nothing serious except to the left side of my face. I had 6 broken bones in the left side of my face
Wow.
and about 14 stitches right in the front in an L shape, on the outside. I don't know how many were on the inside, but, so, yeah, so that's where I was, so don't climb ladders. Anyway, okay.
That's good advice. And I'm sure that was really harrowing for you, and especially to end up with an injury that's on your face that, is front and center. What were you hearing from your doctors, and what were people saying you should do?
I went to a eye trauma surgeon, uh, I guess an eye trauma specialist, and he sent me almost right away to a plastic surgeon, who he, refers to and I guess works with. And I went just, I mean, maybe 2 weeks post injury, and went to the office, and he looked at me and, you know, rolled his eyes, and he told me a 95% chance I would want plastic surgery on the scar, to sort of come back like, I don't know, 4 months later, maybe, or whatever. He also told me in the interim, it might be a good idea to get bigger glasses because my scar was right here. So, you know, anyway,
So
so that's what he
so
told me.
the consensus was that they would need to do an operation, and would that just be to cut out the area where the scar is?
He described it that he would, yeah, cut it all around it and rejoin it, I guess, more properly. I
Right.
didn't ask that many questions because I was a little bit still off my game.
Right.
Um, After that meeting, I thought about it, and my thought was if I need plastic surgery, then I need to go see Dr. Lupo and I need to ask her just straightforward, if this was your face, who would you allow to cut it? That's why I came to her. I knew she would tell me and she would know whoever in the United States I could go to who would properly address this thing that I had to do.
Yeah. And what did Dr. Lupo recommend?
So I was sitting in the chair in her exam room, and she took a look at me, and then she walked around the room a little bit and took a look at me from the side and the other side. And in answer to my question, who should I see to take care of this plastic surgery? She looked at me and she said, Donna, I got this. I got this. She said, it's going to take a little while and you're going to have patience. It's not going to be super fast, but I have got. You don't have to have plastic surgery. And it just wasn't something I would even considered hoping for, to tell you the truth. I just assumed this is the way this is going to go. Um, so she, and if you know Dr. Lupo, you know she would never say it, never, if she didn't know that she could. She would never tell me that. So I thought, okay, well, here we go. We're going to have a journey, she and I, and that's how it started.
Well, your results look amazing. They
Thank
look
you.
incredible, and
Yeah.
Dr. Lupo did an outstanding job. So, what was on your treatment plan, and what did it entail?
You know, I won't have all the words, all the right words, which she can tell you, but I will tell you that she has lots of tricks in her bag, and she used them all for me. So she, what I call jackhammered the scar. She did lasers. She did all kinds of different different things, and sometimes she would repeat,
Yeah.
do it again, and so there was always like when I would sit down in the exam room, she would take a look at where I was in my healing process, and then, okay, Donna, we're gonna do this now, and okay, then we're gonna do this. So she had a plan, and I have to tell you that having a disfiguring scar in the very front of your face, that's, I don't know, the length of of my cheek, is a very lonely place to be. It just
Yeah.
feels, and I felt so much like I wasn't alone anymore, that it wasn't my scar, that it was our scar. And there is something about that that is just, I just can't really describe to you how it made me feel to know, A, she was, you know, really talented and professional and knew all the things to do, but also in her heart, she wanted my face to be better.
Well, you're entrusting her with your face and your skin, and it's so wonderful that she made you feel so comfortable in the fact that you could address it without surgery. So, that's wonderful. And what tell me a little bit, like, I'm sure it wasn't a one and done process. So you had to do multiple treatments. What was your recovery like? Is there anything of note that you want to share with our followers?
I think we would just, I'd come back like every month and we'd take a look at where it was. Because some of what she addressed was allowing my skin to heal from underneath. So,
Yeah.
it needs to like evolve, I guess. And so we would look at it and she would talk to me about it. So I would say that, you want someone who is creative in their practice, who is not a newbie in their practice. Not that there's anything wrong with that, but this was, she applied all those years of training and experience to help me heal. And every time I sat in the room and she looked at it, she was figuring out what to do next. And I think you have to have someone you trust that you know is in it for you, which she totally was and is, um, and who knows all the tricks in the
Right.
back, and she does. So I think I never ever thought that there would be an answer that wasn't surgery. I didn't I didn't think that. So, and I'll do this for you. This is it right here, and
It
you can
looks
look
so
at it
good.
and you can see it is pretty amazing. So.
Yeah, she did a wonderful job, a beautiful job. And did you have those treatments all stacked on the same day, or was it spread out?
Spread out. Yeah, it was, this day we did these things or this two things, and then 3 weeks later we tried this, and then a month later we did that. And so it was always a revisiting of where we were in that time and what needed to happen in the next step. So, and then she was very communicative with me about it as well. So explained it and what she was doing. And so it just made me feel like I was right. I mean, you couldn't ask for anything better.
And so how do you feel now with your results, and how has it changed how you present yourself?
That it was a big accident. It really was. And it's even scary to think about it now, what could have happened. So I guess what I feel is gratitude that I was able to find the friend and the professional that I needed to help me um, get to this place. And I don't even think about it anymore. I don't think about it. And if you would to see it when it happened, you would think I would be looking at it for the rest of my natural life.
Right.
And it doesn't. And even my friends will be like, Donna, I forget you even had an accident. Like it's completely obliterated from people's. When they look at me, they don't think, oh, poor girl, she has a scar. So
Wonderful. I am so grateful to you for coming and speaking to us and sharing your story. And I know Dr. Lupo is going to give us more detail about your treatment. But thank you so much for coming and speaking with New Beauty. And again, you look so good. And I'm with your friends. It never happened.
Thank you very much. I appreciate it.
Thank you so much, Donna. Hi, Dr. Lupo. How are you?
I'm well. How are you?
Great. Thank you for joining New Beauty. And we just talked to Donna and saw her amazing results. And I just wanted to know what makes Donna or someone like Donna a good candidate for a non-surgical scar treatment like this.
Well, number one, Donna and I had a pre-existing relationship that was built on a long period of time of trust. And she knew that I always had her best interest at heart. And so we had trust. And the second thing is Donna's very disciplined. Donna is a very compliant and very cooperative patient. She does what she's supposed to do. You know, a doctor can't do it alone. You have to have patients who make their follow-up visits, that do the things after a procedure for optimal healing. So the combination of our relationship and the trust and me knowing that she would see this through, because frankly, almost every scar can be approached non-surgically, but you have to have the type of patient who is patient and
Yeah,
understand that the non-surgical approach, whether it be for a revision of a scar or for a restoration of your face aesthetically, it's a process. It's not a one and you're done, at least not from the standpoint of non-surgical procedures. So you have to have a patient who understands that and can be compliant.
and a scar in particular is so emotional. There's so much tied into scars, the old scars, new scars, where they are on our body. So how do you help patients understand what's possible and what their options are beyond plastic surgery?
Well, the first thing I do is thoroughly examine the scar. And what was relevant with Donna's scar is she had a significant avulsion of skin, meaning she actually lost tissue. And
Oh,
as a result of that, um, the scar was very indented and it was in a terrible location because it was over this very prominence of her cheek. And
yeah.
there's a very large muscle there. And every time she would even smile, that scar was pulling and tethering and would actually get more indented.
Mhm.
And so you feel very inhibited as a person that you're going to accentuate something that's bothering you just by interacting with people.
Right,
um, you can certainly get scars in worse areas than others, and this was probably the worst area you could get a scar because it's a very dynamic area that projects,
right,
and it was tethered down, and I had to do a lot of work to release the tethers, the scar tissue that was actually puckering it down, and
right.
that's what she described as I assure you, I did not jackhammer her face. I did. I,
I figured she meant that was microneedling.
no, no,
No,
no.
it wasn't
No,
microneedling?
this is one of the oldest things in the book. We used to do it a lot, still do it a lot for acne scars. It's subcision,
Oh, subcision,
where we go under the scar and we break up the scar tissue.
which you use for cellulite as well, right?
You
You
can.
can, yeah, but
And
you're
so
essentially freeing that, what's holding down that part of the tissue.
and when I would do her subcision, which was one of the procedures that we did, um, I would also put a layer of hyaluronic acid, which is you remember what hyaluronic acid is in the skin? It's a lubricant, it's a glide. It makes your skin springy. So I was releasing the scar tissue and putting a layer of hyaluronic acid that acted like a cushion to keep it from puckering down again.
Topically or a hyaluronic acid filler?
Filler, a
So
hyaluronic acid filler.
okay.
As I was subcising,
Yeah.
at the same time, I was
Wow.
injecting hyaluronic acid.
Wow.
And then another little trick I did was I did micro Botox.
Okay.
And the reason I did that was you can't do aggressive Botox in this area because then she couldn't smile at all. But I wanted to release some of the muscular pull down and tension. And studies have shown that the use of Botox after a scar, and this is with a skin cancer scar,
Mhm.
it scars less. So I
Wow.
incorporated that little trick of using micro Botox to also help. And then, of course, we did do the less aggressive times. We did micro needling, but we did ultra clear, we did Fraxel, and I describe it as I walked in the room that day and it was like walking in on a chessboard
Mm,
that someone had made a move. And
right.
I was now in a chess match with her face, her healing mechanisms,
Right.
the way it had been sewn together. So I was presented with that. And so I drew from my knowledge of what to do. And it was like I made a move.
Right.
And then I'd see her back and see how did her scar respond to the previous treatment. And so what's my next move or step or treatment, if you will?
See, this is why we have to talk to the doctors too, because it was much more than just jackhammering, but it's so nuanced and it really speaks to your abilities and your expertise that you have this toolbox that you go to and you know how to pivot to get the best result in the end. So,
It really is truly a case of sometimes when you have a lot of experience. Remember, I've been a board certified dermatologist for 40 years now. You know, it's hard to explain how you know what you know
right,
because the brain and how we catalog things and how we draw from past experiences. Because I've been taking care of scars since I was a resident at Tulane in dermatology and taking care of people who had been injured, traumatic injuries, skin cancer scars, acne scars. I've been actively treating those since 1983,
yeah,
and you just you just know, and that's often the problem. I think when you don't see someone who has the credentials, the training, and the experience, there are people out there who don't even know what they don't know.
right,
They haven't a clue.
right. Well, it's wonderful that Donna has you and that she was able to treat this in this fashion without having to go under the knife. Um, so, okay, what is your best advice for anyone who is dealing with a scar and is facing the same, question that Donna had?
Well, I think the main thing is especially if that scar is bothering you on the inside, because how you look on the outside, you owe it to yourself to get it treated. And the most important variable is who do you see? What is their training? And quite frankly, what is the ethics of the person? Because there's too much upselling now, people doing more than is necessary just to make more money. And it should never be about anything other than what's good for the patient, what's good for this problem, and how can you help this patient. And let me tell you something, your reward as a physician for having someone as happy as Donna is, it's touching, it's gratifying. Donna and I are similar in age, and we have a lot in common. She's a successful business owner and a very dynamic, outgoing mother, grandmother, and so there's a certain amount of symbiosis that we had. And I really did feel like this journey was ours to take together.
Oh, that's so beautiful. And you did an amazing job. And Donna's really just, saying your praises and is a testament to your good work. So I love this story. Thank you so much for bringing this to us.
Well, I'm glad you thought it was worthwhile because sometimes little things can make a big difference.
Well, there's so much of an emotional component too to aesthetic treatments. And I think sometimes it's so relatable for people to hear from other patients that have had the same journey. So thank you again.
Thank you, Tatiana. Good seeing
Thank
you.
you.